My name is Chryssa. I'm Director of Marketing for Primary Health Medical Group. I'm going to talk to you today about high-level brand strategy. We are going to dive right in. I would like everybody to please get out the billboard template that's in your folder behind your agenda. And I want you to grab a Sharpie, because I'm a marketing person. There's always going to be a Sharpie at the table. And I want you to take 1 minute to sketch out a billboard for your business. 1 minute, rough it out. Drop a billboard for your business. And use that top template because we'll come back for the second one. Doesn't have to be perfect, just sketch it out. If you're in charge of your billboards, what is your billboard going to look like for your business? "30 seconds. Okay, 10 seconds to wrap up. Put your final thoughts down on the page. Okay, set those aside. We will come back to those at the end of the presentation. So to start off, what is brand strategy? That's a pretty loaded term, right? Brand strategy is the holistic approach behind how a brand builds identification and favorability with customers. So think of brand strategy as everything you're doing to make yourself known and to gain new customers. When you're building your strategy, there are so many different ways to approach it. I've narrowed it down to five points to focus on for today. Identifying your target audience, developing your UVP, your unique value proposition, developing your messaging, assembling your toolkit, and then measuring and adjusting. And that measurement piece is so important. So when it comes to identifying your target audience, I'm sorry, it cannot be everyone. I think it sounds great to say, I'm targeting everyone. I'll get more customers that way, right? It doesn't work that way. If you need help kind of narrowing in on who your target audience might be, sit down and start making a list. Who is most likely to buy from you? Just jot down some characteristics of the people you think are most likely to be a customer for you. At the same time, who is least likely to buy? Is there any demographic you can automatically rule out because you're just not going to be able to offer what they're looking for? Your current and past customers. This one is so valuable. Use an online, web-based survey tool to ask some lifestyle and demographic questions of your customers. And look for themes while you're doing this. So you're not going to be making a marketing change or a business change based on every survey response that comes in, but you are going to be looking for those themes, those things that keep rising to the top that are going to help you focus in on who your ideal target audience is. When you do this, it's really important that you let go of assumptions. So you might think, oh, I know exactly who I'm targeting. I know exactly who my ideal customer is, and you might be wrong. So keep an open mind to what the data is going to show you. I have a great example of this. Before I worked at Primary Health, I was with a pet health insurance company. And when I started working there, it was after the recession. They'd gotten rid of their entire marketing department. And I realized that we had no idea who our customers were. We knew everything about the pets who were being insured, their breed, their zip code, their nicknames, when they had their last vaccines, their spay-neuter status, but we didn't know anything about the humans who were actually purchasing from us. So some of us from different departments got together just based on our gut, and we're like, yeah, okay, so here's probably who it is. Probably middle class, right? They've got a little extra money to pay to take care of their pets, probably have kids, probably a busy family. They don't have time to worry about unexpected vet bills. So we sent out a pet parent survey, and the results started to come in, and we realized we were totally wrong. The reality is that most of our policyholders were at the high and low end of the income bracket. High end because that group is accustomed to insuring pretty much everything, and the lower brackets because those typically were seniors on fixed incomes who knew they wouldn't have access to cash or credit in a pet health emergency. We also discovered that they pretty much didn't have any kids living at home, because when you don't have human kids at home, your pets are your kids and they're going to get more of your attention. So we were totally off base, and our current customers were able to tell us who they were. All right, next up, developing your UVP. This is your unique value proposition. It's the core benefit that sets you apart from the competition. Developing your UVP, you want to be concise and specific. Avoid those vague terms, avoid those vague promises. You also want to make it about your customer. So your UVP should not be about something that you're doing or a way that you're feeling. It should be about how your customer is going to feel or the benefit that your customer will experience working with you. Some examples, weak UVPs. We care about you. Our business cares about your family, right? How often do we see that type of thing? Same thing with 5-star service. Best service in the Treasure Valley. That's really hard to understand specifically what that means. Strong UVPs. I like this one for Uber, the smartest way to get around. And this one for Slack, be more productive at work with less effort. So you've got action verbs in there, and you've got clearly stated benefits to what your customers are going to experience working with these brands. Now keep in mind, your UVP isn't necessarily your tagline or a headline. So the Uber TV ads aren't going to say, Uber, the smartest way to get around. But the UVP is going to drive your marketing messaging and support your overall messaging. So once you've developed your messaging and it's time to make the marketing pieces, I want you to focus on one thing in each marketing piece. And I have a whole separate talk on one thing that's a lot of fun. If you're interested in that, chat with me afterwards. When you focus on one thing in marketing, it's easier to communicate. It's visually going to be more appealing because there's less going on. And it's going to help you focus on your most valuable message. It's going to help you cut the clutter. I love this print ad for McDonald's. It's obviously quite old because Wi-Fi in restaurants is not news anymore. But think about all the things you could say about McDonald's. The 99-cent menu, the frozen Cokes, the McRib, all the news, right? But this print ad focused just on the fact that, hey, we have Wi-Fi now. Very effective, and it has really withstood the test of time. Okay, so what is your one thing? How on earth are you going to pick which one thing to talk about in your marketing pieces? Ask yourself these questions. What is my easiest sell? Is there something I offer that people just instantly get and they understand and they're interested? What is the most common need I can meet? Do I solve a problem that a lot of people are facing that, again, doesn't take a lot of education to explain what I can do for them? What brings people in the door? Maybe you have an event that's always really successful, or a free sample that's really popular, or some other promotion that drives a lot of traffic. Focus on that. Let that be your one thing in your marketing. Another good question is, what's new? Maybe you have a new location. Primary health, that seems to happen about every other month. Maybe it's extended hours. Maybe it's a new service line. Maybe you just hired a rock star manager. Maybe you just hired Kevin and you want everybody to know about it. Let that be your one thing in marketing. Okay, building your marketing toolkit. These are the 5 things that I've identified I think every business needs, no matter how small, no matter how new, no matter how well-known, regional, whatever you might have. You have to have a website. And I still do business with places, or try sometimes, with businesses that don't have a website. It's crazy. You need a website for content and SEO. This is where you're going to put the words and the information that will tell Google what you're about and will help connect people to you. You also need a social profile, at least one. Doesn't matter which platform, but pick one. Customers are going to expect this. They want to see maybe pictures of your storefront. They love seeing before and after pictures. They're going to want to see some reviews maybe that other people have left for you. Sometimes they want to DM you a question because there's a certain generation that really doesn't want to pick up a phone and talk to a human, and they'd rather chat you their question. You're also going to need Google and Yelp profiles for customer reviews. Now, you might have learned this the hard way. If you don't make yourself a Google or a Yelp profile, your customers can make one for you. Actually, anyone can make one for you. They can upload pictures, they can post reviews, they can type your business name, they can spell it wrong, they can get your phone number wrong, and you're not going to have any idea because Google and Yelp won't know how to get a hold of you. So if you're not already actively on Google and Yelp, I want you to go search for yourself or your business there. If there's a listing, you can claim it for free and you can start to manage that profile. Respond to reviews, take down photos that don't make sense, upload your logo, that type of thing. Next is an email marketing service. So these are going to be really important in terms of keeping that connection going with customers and leads. So there is a cost associated with these, but you can't just copy paste everyone into a BCC and do your email marketing that way. So get connected with an email marketing service so that you can keep that conversation going. And then don't overlook basic print materials. There is still a place in the marketing world for things like a business card and a simple flyer. You're going to run into people who want those things. When I worked at the pet health insurance company, we'd have people go online and Google our 800 number and call and talk to a rep and say, can you please mail me a brochure? And so we would mail them brochures. So even when you're e-commerce, there's still going to be a place for paper print materials. Here's a bonus box for you. These are the items that I've identified as the most cost controllable marketing avenues. Number one is press releases. Learn how to write a great press release. Host an event, donate a portion of proceeds to a local charity, send out your press release. You will absolutely get media coverage for it at no cost other than your time. Events, there are so many great events to attend in the Treasure Valley. If you have questions about how to vet those and make sure you're spending your time and money in the right place, come chat with me afterwards. I have quite a few ideas on that. Local print and local radio can also be really affordable. To bring up the Chamber again, the Chamber of Commerce directories at Primary Health, we run print ads in those every year. They're very affordable, and the ad lives for the entire year. With local radio, a lot of times local stations will help you write and produce, and then you tell them what your budget is. You know, you don't have to go in with 10 grand to do this type of stuff. Same thing with Google search ads and social promotion. Both of those you can set very low daily budgets, and you can say, Google, I have $5 to spend a day. Run those ads for $5 a day, see where it gets you, adjust, and decide if you want to keep going. And then also that email marketing again. Once you're paying for a monthly service, you typically don't have to pay again and again for every email you send. It's kind of a monthly thing. Measure and adjust, so important. If you're doing events, count attendance at your events. Get a carnival clicker. Click everyone who comes up to your booth, right? You want to know if it's going to be worth your time. Same thing, track phone calls. If you're running a promotion, have a pen and paper by the phone and actually mark down anytime somebody calls about that promotion. You don't want to just have to go off your gut later in terms of, gee, was that worth it? Monitor your social engagement and your web traffic. The social media platforms will give you tons of information, and then your web traffic, you can use Google Analytics to do that. Put some code on your site. That's a free tool. You can start to look for trends in days and times and even demographic info in terms of who's visiting your website. And you can also do promo codes and QR code scans. We have some large posters in front of 3 of our clinics right now with QR codes that are trackable, and we are using them to promote some doctors who are taking new patients. So I can log in online and say how many people have scanned that QR code today to book with Dr. Wilson at Primary Health. If it works, great, we'll roll it out to more clinics. Not working, we won't roll it out to more clinics, but at least we know before we go and do that for 23 clinics, right? Okay, let's go back to the billboard template. Think about what we just talked about in terms of your unique value proposition and your one thing approach to your marketing pieces. You're going to take 1 minute to make yourselves a new billboard on the bottom template there. And then if we have any volunteers to show the before and afters, I always like to highlight a couple of them. I think 9 out of 10 times your second billboard is going to be so much more strategic and effective even after just a 15-minute exercise. So thinking about your UVP and thinking about one thing in your marketing pieces. Think about 15 seconds. It's a quick exercise. Do we have any volunteers? Anyone super proud of their after that they want to share? I'm not going to choose volunteers. This is a personal exercise. But if we have anyone who wants to share, we'd love to see it. All right, we got one. You want to bring, yeah, we'll bring it up here. Okay, you're Taylor and you are with?
Water.
Solve internet problems, ping plotter. Good. So really his before was great. Second one, better remote workers, ping plotter. Okay, right? How is that for the UVP? Solve internet problem versus better remote workers, right? Billboard B is the winner. Thank you for sharing that. Anyone else want to share theirs? Better remote workers, like everybody wants that right now. Are you volunteering someone over there? Okay, I'd love to see it. Heather, who are you with, Heather? She is social. The first one says, let's get social, has kind of like an Instagram. Bottom one says, making social media easy. Let's get social. That's great. So yeah, love it. Thank you for sharing. Even just tweaking a couple words like that on a billboard, now we know what they're offering us, right? Now I know what for me as a customer I can expect as a benefit working with them. Okay, Q&A. Questions? Yes. Yeah, so we said the QR code isn't working, so what's been the greatest communication success? It would be really tricky to narrow it down to just one thing in terms of what's working, because we have so many different needs, right, among our patient group. The more targeted, more specific stuff is always going to be more effective. So we do a targeted direct mail piece to new movers that say, hey, you picked a great neighborhood. We should know because we're here too. And then it directs them to their neighborhood primary health. We see a really strong ROI on that new mover. We do that every 90 days. Other things, when we can target email communication, make sure that we're reaching out to the right people, getting the right message to the right people, that's pretty much always going to be a win for us. The thing with the QR code in front of a clinic, it's super vague. It's not targeted at anyone specific. They have to notice it. They have to need a pediatrician. They have to want to scan the QR code. My gut told me it wasn't going to work, but I had to let the project speak for itself instead of just being an idea killer. Other questions? Yes. Yeah, great question. Yes, how long do we give each individual marketing program before we decide if it's not working? So the benchmarks are a little bit different for each item. If it's something online, you typically want to wait till you have at least 500 to 1,000 impressions, 500 to 1,000 opportunities for someone to engage with you, to look at that click-through rate or to look at the ROI and be able to make a call. In the case with the QR codes and the posters, for example, they're getting almost no scans. So that's super obvious, right? Now, maybe the staff aren't putting them out every day. So I told my team, I said, let's give it the month of May, but then I'll probably be ready to call it. So really sometimes it's a wait and see, but kind of like figuring out your target audience, you're looking for those themes, you're looking for those trends. And so it depends on each piece. Yes. Are we using any AI? We are not. We're not using AI. We don't have such a high demand for content that we have that need. I think for some e-commerce companies where they're needing to generate content constantly, I could absolutely see where that would come in handy. And I've done that. I've like with the pet insurance company, it's an online brand, and so you're living and dying by your blog sometimes. But yeah, primary health, we don't have such an immense need for that content to use AI. And that's really attributable to the fact that we have so many in-person locations and that the people's experience with brand experience with us is really an in-person experience above all. Any other questions? Yes. Primary health UVP, that's a great question. So we have 5 brand values that we want to be: high quality, comprehensive, convenient, affordable, and friendly. Our marketing focuses solely on urgent care, even though we offer a number of different service lines. And so we go back to those 5 brand values in terms of all of our marketing. So we want everything we do in and outside the clinic to reflect back on those 5 values. Other questions? Yes. Sure. So he's asking, when you're working on the UVP and you want to think about how the customer will be feeling, do you want to only focus on the positive emotion, or can it be negative or anything else? That's a great question. I think it would definitely tend toward positive, but you might touch on a nerve, right? A frustration that they're feeling with the current situation. So I think there would be a way to kind of word it so that you're acknowledging, hey, what you're doing right now is really hard, and we're here to make that easier for you, that type of situation. But I think generally you're going to be leaning toward positive, because you want your customers to be feeling optimistic about a relationship with you or your business. Is there another one here? Yeah, on old school marketing, where do you draw the line? So actually, like I said, direct mail is one that's so valuable for us and really impactful. It's important that you know who you're marketing to, who you're mailing to. And so again, do tests and direct mail. I guess I should add that to my little bonus box there. That's another one where you can go to the company and say, you know what, I have $500 to spend on this campaign. How many households can I hit that are going to reach these, demographic guidelines? And see how it works. See, so what we do in our case is the service we use includes a match back. So 90 days later, we can find out how many households came into a primary health for the first time after getting our postcard compared to a control group. And that service is included with the company that we use that does the mailing for us. So, and it shouldn't be a lot. So direct mail can add up, but when you get to certain quantities, you're looking at less than $1 a household to target. And when they're already going to be somewhat qualified, that's a pretty reasonable price. Of course, business cards and flyers and stuff, those are so low cost. Just having them handy is valuable. Any other questions? I see like a half question in the back. Yes? No? Maybe? Sure. Yeah, absolutely. Yeah, he's asking. So people don't come in unless they're sick, right? And I always say that I can't make somebody need an X-ray. I can't make somebody have a sore throat, but I can make them think of primary health first when it happens. So we are really all about awareness. And when I was in an e-commerce company before, we were living and dying by those daily quotes and sales, right? And you see them coming in through Google all day long. Switch over to primary health, and you might launch a marketing effort, and you've got to do a 6 to 12 month look back to start figuring out how effective is this? During COVID, we were getting thousands of first-time patients every month for COVID testing and vaccine. That is a once in a lifetime opportunity to have that many new leads handed to you, right? And so we put them into a special 12-week follow-up campaign that's a combination of direct mail, text, and email. And we are literally on a 12-month schedule of look back to see what percentage of these customers have returned to primary health for a need other than COVID vaccine and testing. And we're right at about 35%. So now we start tweaking that follow-up series and withholding certain groups to see which piece of that follow-up marketing campaign is more effective. And I won't have that answer for at least 6 to 12 months because people don't need urgent care, right? It's like 1.3 visits a year or something, is the average. So yeah, it's definitely the long game. Definitely a wait and see. Anything else? Yes. Yeah, for email marketing, what is the frequency I recommend? At Primary Health, we will easily go 4 to 6 months without emailing our full patient list. Because if we don't have something important to say, we're not going to bug people and make them unsubscribe. Because then when we do really want them to know that the new Nampa clinic is open, they'll still be on our email list. But we do reach out more frequently if we have something specific to say to a targeted group. So I think as long as what you have to say is valuable to them, not just you, and you're targeting your communications and they're hearing from you once a month is reasonable. I think we've all had that experience where you make an online purchase and you immediately start getting multiple emails from that place. And what do you immediately do? You hit the unsubscribe button. Your future 20% off on something I might need is not worth what you're doing to me right now in my inbox. So, I mean, I would start with once a month, a little bit more if you have something really specific to say, but be very judicious with it. Yes. Sure. Yeah, great question. In terms of the one thing, and I'm able to get into a little bit more detail on that in my talk that's just about the one thing. That's really going to depend on your product lines and what your own schedule looks like. But you would definitely want to plan ahead, maybe for the entire year, in terms of which one thing you're going to focus on at a time. I think it makes sense for them to run parallel if they're targeting different audiences. I think for the sake of clarity, especially if you're working with a smaller marketing budget, just go big on the one thing that has worked and maybe spend a quarter on that and then shift gears. But you want it to be cohesive, right? So you want it to be reflective in what you're talking about at events, what you're doing on social, what's highlighted on your website. If you can batch it like that and make a focused effort, I think you're going to see good results from that. Yes. What resource do I use to gather data? So it kind of depends. Obviously, in healthcare, it's private. You can do all kinds of shady stuff with that data. We do none of it. You can upload email lists to Facebook and target those people, you know. I mean, in theory, we could pull an email list of every patient who's come in with hemorrhoids and target them on Facebook. No, that is too far. Technically, it's legal. Absolutely not. For the direct mail, that's really kind of our heaviest data point. We work with a company called DXM. They're in Georgia, actually, and they pull that data for us. We don't ever see that data, and we don't ever get to keep it. We basically rent it for a one-time mailing. So if you've moved, you know that you get all kinds of coupons and new mover type stuff in your mailbox. That's where those come from, is companies can go out and do a one-time mailing to that list without ever keeping the data. In terms of internal data, we have just an incredible amount of reporting. The patients who opt into our secure system are the ones that we can put into that 12-week follow-up program for new patients, for example. So they opt into that, and then we can securely send them text messages and that sort of thing. Anything else? Great questions today. Okay, thank you.